I'm Dr. Jeff Bettinger, Pain Management Pharmacist, and really what that means for me, because if you ask 15 different pain management pharmacists that question, they'll give you 15 different backgrounds. So I became a pain management pharmacist through postgraduate residency training, which isn't required for pharmacists. You start with the first year residency, which is more general after graduating pharmacy school, and then onto a pain and palliative care residency. And what I do now, I work with Saratoga Hospital Medical Group between about 8 of our different primary care clinics, running from clinic to clinic most days. And it's essentially a pain clinic embedded within primary care. So as the pain management expert, I collaborate fully with our primary care providers and physicians in managing chronic, complex, usually non-cancer pain. I consult a lot with addiction medicine, behavioral health, neurology, our inpatient side for acute pain cases. But usually I'm more treating, again, complex, chronic, non-cancer pain.
So your talk at Pain Week is focused on pharmacogenomics. Could you briefly explain what this is?
Sure. Pharmacogenomics is essentially the study of drugs, which is pharmacology, and your genetics, and how, which is, of course, genomics, and how your genetics determine your reactions to, and even the metabolism of specific drugs that you're going to be taking. So in a general sense, that's what the definition of pharmacogenomics would be.
So how does pharmacogenomics play into personalized medicine?
Pharmacogenomics, we often call it the new frontier, the final frontier. I feel like we've been calling it that for the past 10, 15 years. It plays such an important role, and we're really just scratching the surface of it. What we know from a receptor expression, so how drugs are actually working and binding to specific receptors to produce specific effects, whether they're antidepressants, opioids, anticonvulsants. We already know certain genetic variants that can, cause increased activity by that binding or reduced activity at that binding. So it would ultimately can determine outcomes, patient-specific outcomes, how you're going to respond to a certain drug. So I think it's extremely important. And like I said, we're scratching the surface. We only have 30, 40 specific genotypes that we have a lot of data on, or sufficient data on, with specific phenotypes of receptor and drug metabolism expression. That's the other whole part of it, is how these drugs, when we take them, how they're broken down by our bodies, right? That's the other part of it where we see pharmacogenomics playing a role. If someone specific enzyme is overreacting and because of genetics, and it's breaking down that drug that they're taking way too quickly, it may lead to worse outcomes. They may not get as much of a response. In the opposite situation, if the specific enzyme is just not working as well or as fast as it would in a normal metabolizer, that could lead to potential harm in terms of increasing the amount of drug that is circulating in the body, not being broken down. So again, scratching the surface of pharmacogenomics, but already I think it plays a vital role, from pain management to mood disorders and everything in between.